Welcome to Taking a Bite Out of Dental Sedation. We're here with Emma, who is our Dental Sedation Nursing course tutor, and we're just going to jump straight into it. Emma, could you tell us what is dental sedation?
The dental sedation is a conscious sedation technique, which uses drugs to produce a state of depression of the central nervous system, enabling treatment to be carried out. But because it's conscious, it means that the patients are able to respond to your verbal commands. They're not fully asleep. It's just a process of relaxing them. They won't remember treatment if they have a certain type of sedation, and it's just makes the process of them having their treatment a lot easier.
Okay, nice. So when would we use it? Do you have any examples of circumstances?
So patients that are highly anxious are great patients for sedation. They can come in, they don't need to remember, their anxiety is reduced. They basically sleep through the appointments to the point where you finish the treatment and they're asking, when are we going to start? So anybody who's highly anxious, it's brilliant. Children, they can have inhalation sedation, and if they're anxious, say they've got to have extractions or things they're just not going to sit still for, or they're not going to tolerate, a little bit of inhalation sedation can just reduce that anxiety, relax them, and enable us to do what we need to do.
Okay, amazing. That's great. And so in that case, well, what does a dental sedation nurse do?
Okay, so as alongside your general dental nursing duties, sedation nurse, depending on the procedure, obviously will set up, do the relevant checks on any machinery that we're using, check that all of the drugs and equipment is all in date and serviced correctly. When it comes to the appointment itself, obviously you've got to have your emergency drugs to hand just in case of an emergency, and you're really that point of contact for the patient. So it's really a case of reassuring them, sort of helping them along with their journey, whether they've got to have a cannula, sort of supporting them through that, distracting them, using sort of hypnotic tones if you're doing inhalation sedation, because that really helps with the inhalation sedation taking effect. You complete all the pre-sedation checks, the post-sedation checks, sort of give verbal, pre-operative, post-operative instructions, and you are that point of contact for the patient. So ensuring all the consent forms are signed and that you're ready to go and you have up-to-date medical histories and relevant documentation for the dentist.
Okay, great. So really quite a thorough role there, really lots to do. What have you seen? What is the impact on patients' lives when we're able to offer this service to them?
So we've had patients that we can't even get through the surgery door because of their anxiety, and we have sort of built up a rapport with them, treated them with sedation to the point where they're no longer having sedation for sort of routine appointments, which is great. That's sort of the ultimate goal, is to wean them off the sedation. So from that perspective, seeing that is brilliant. It's one of the best parts of the job, is being able to reduce that patient's anxiety to a level where they're actually able to come in, have a chat, have a checkup, have a scale and polish, sort of just do general dentistry without them needing that sedation. Obviously, for more complex treatments and long treatments, sedation is great, sort of as a one-off as well, just to help the patients get through that sort of duration of treatment. So it has its benefits, but the patients that are so anxious and you can eventually wean them off are the best patients to see, because they take such a big journey with you, and it's an amazing outcome.
Yeah. No, I've seen it. It's great. What would you say is your favorite thing, or what's your favorite thing about being a dental sedation nurse?
So I've done sedation in quite a number of different settings. Probably my favorite is seeing the patients overcome their dental anxiety altogether. However, from sort of a nursing perspective, I've always enjoyed the implant side of things. So when we do those big complex implant treatment plans and the patient's sedated and you're sort of multitasking, helping with the sedation, their checks and various things, monitoring them throughout, as well as doing the implant side of things, that for me has always been my favorite thing to do in dentistry.
Yeah. Okay. And so to wrap up our last question, who then would you think is who's the ideal dental nurse to come onto this course?
So any dental nurse that is in a practice that offers sedation, it's invaluable to have. To work alongside your dentist, you need to have a qualification, and the qualification that we offer from the NEBDN is a really well recognised and sought after qualification, and it helps you progress your career even further if you wanted to, say, go into a hospital setting instead of a practice. So any nurse that has a sedation option, whether that's inhalation sedation or intravenous sedation in their practice, it's great to have the qualification behind you to be able to assist your dentist with the sedation.
Okay, amazing. Thank you so much, Emma. And that's it for taking a bite out of dental sedation.